Stage renal failure, NCLEX questions. A 55-year-old male patient is diagnosed with chronic kidney disease. The patient's recent GFR was 25 milliliters per minute. What stage of chronic kidney disease is this known as? This is known as stage 4 of CKD because the GFR, glomerular filtration rate, for this stage is 1529 milliliters per minute. Patient's GFR is 25 milliliters per minute. The other stages criteria are as follows. Stage 1. Kidney damage with normal renal function GFR greater than 90 milliliters per minute but with proteinuria, 3 months or more. Stage 2. Kidney damage with mild loss of renal function GFR 60-89 milliliters per minute with proteinuria, 3 months or more. Stage 3. Mild to severe loss of renal function GFR 30-59 milliliters per minute. Stage 4. Severe loss renal function GFR 15-29 milliliters per minute. Stage 5. End-stage renal disease GRF less 15 milliliters per minute. A patient with CKD has a low erythropoietin, EPO, level. The patient is at risk for B. Anemia. EPO, erythropoietin, helps create red blood cells in the bone marrow. The kidneys produce EPO, and when the kidneys are damaged in CKD, they can decrease in the production of EPO. Therefore, the patient is at risk for anemia. A 65-year-old male patient has a glomerular filtration rate of 55 milliliters per minute. The patient has a history of uncontrolled hypertension and coronary artery disease. You're assessing the new medication orders received for this patient. Which medication ordered by the physician will help treat the patient's hypertension along with providing a protective mechanism to the kidneys? A. Lisinopril. There are two types of drugs that can be used to treat hypertension and protect the kidneys in patients with CKD. These drugs include angiotensin-converting enzyme inhibitors, ACE inhibitors, and angiotensin receptor blockers, ARBs. The only drug listed here that is correct is lisinopril. This drug is known as an ACE inhibitor. Metoprolol is a beta blocker. Amlodipine and verapamil are calcium channel blockers. Which patient below is not at risk for developing chronic kidney disease? A. A 58-year-old female with uncontrolled hypertension. B. A 69-year-old male with diabetes mellitus. C. A 45-year-old female. C. A 45-year-old female with polycystic ovarian disease. D. A 78-year-old female with an intrarenal injury. Options A, B, and D are all at risk for developing CKD. However, option C is not at risk for CKD. A patient with stage 5 CKD is experiencing extreme pruritus and has several areas of crystallized white deposits on the skin. As the nurse, you know this is due to excessive amounts of what substance found in the blood? B. Urea. This patient is experiencing uremic frost that occurs in severe chronic kidney disease. This is due to high amounts of urea in the blood being secreted by the sweat glands onto the skin, which will appear as white deposits on the skin. The patient will experience itching with this. Your patient with chronic kidney disease is scheduled for dialysis in the morning. While examining the patient's telemetry strip, you note tall peak T waves. You notify the physician who orders the stat basic metabolic panel, BMP. What result from the BMP confirms the EKG abnormality?
D. Potassium 7.1
The patient's potassium level is extremely elevated. A normal potassium level is 3.55.1 mEqL. This patient is experiencing hyperkalemia, which can cause tall peak T waves. Remember, in CKD, especially prior to dialysis, the patient will experience electrolyte imbalances. especially hyperkalemia. You are providing education to a patient with CKD about calcium acetate. Which statement by the patient demonstrates they understood your teaching about this medication? B. I will take this medication with meals or immediately after. D. This medication will help prevent my phosphate level from increasing. Calcium acetate, also known as FOSLO, is a phosphate binder, which will help keep the patient's phosphate level from becoming too high. It helps excrete the phosphate taken in the food by excreting it out of the stool. Therefore, it should be taken with meals or immediately after. Option C is wrong because the patient should avoid these types of foods high in phosphate. While assessing morning labs on your patient with CKD, you note the patient's phosphate level is 6.2 mg/dl. As the nurse, you expect to find the calcium level to be. A normal phosphate level is 2.74.5 mg/dl. This patient is experiencing hypophosphatemia. When hyperphosphatemia presents, the calcium level decreases because phosphate and calcium bind to each. When there is too much phosphate in the blood, it takes too much calcium with it and it decreases the calcium in the blood. Therefore, the nurse would expect to find the calcium level decreased. A patient with stage 4 chronic kidney disease asks what type of diet they should follow. You explain the patient should follow a low protein, low sodium, low potassium, low phosphate diet. The patient should follow this type of diet because protein breaks down into urea. Remember, patient will have increased urea levels, low sodium to prevent fluid excess, low potassium to prevent hyperkalemia. Remember, glomerulus isn't filtering out potassium phosphate as it should, and low phosphate to prevent hyperphosphatemia. The kidneys are responsible for performing all the following functions except maintaining cortisol production. The adrenal glands are responsible for maintaining cortisol production, not the kidneys. Activating vitamin D, B secreting renin, C secreting erythropoietin.